The conversation on the HPV vaccine has been around for more than a decade now. In fact, before it was taken on as as part of the national formulary, parents who were knowledgeable about it and so doctors who were knowledgeable about it would secure the vaccine from neighboring islands and bring it on board, and we would introduce it to our children, our young boys and girls. But as a national formulary, I believe the introduction to schools and so on began somewhere around 7, 8 years ago as part of the usual vaccination that are given to children. The exact numbers of girls that are inoculated, I don't know the exact number of persons, but one can guess that it would be, a few hundreds well, because it's given to a particular age group of girls, not necessarily to the boys as yet, although we encourage parents who are interested to vaccinate the boys against it as well. But that age group of between 9 and 15 are the target for vaccinating girls at this age. So it's probably a few hundred as well, but the exact number is unknown at the moment. The cancers that affect women the most are the gynecological cancers. So that includes cervical cancers, endometrial cancers, ovarian cancers. Of course, when you look at gastrointestinal cancers as well, when you add them up, they probably come up to about the same numbers of the gynecological cancers. Breast cancer is still, although breast cancer is still actually the number one cause of death. And that is simply because the gynecological cancers, by and large, can be diagnosed earlier where more curative measures can be taken. Cervical cancer, for example, which is the one that is mostly caused by HPV, basically through the use of the pap smear and through other colposcopal procedures, we can actually take care of the cervical cancer. So women generally don't die much again from cervical cancer, except if in the rare cases where they ignore getting their pap smears, or in some cases where they do not have a vaccination, that it makes them and put them at increased risk of dying from it. The cervical cancer, the amount of patients that we engage is pretty common. But it is more common to see them in the precancerous stages or the very early cancerous stages. It's not very common to see them in the late cancerous stages. And again, it is because of that guideline that regulates or encourages women to get their pap smears every year or every 2 years, as the latest guideline have shown. So generally we see them when the cells have just begun to change, or metaplasia as we call them, or dysplasia, where the cells have just begun to change and not full-blown cancers yet. And those we get more than the full-blown cancers because of the pap smears that they get over the years. Yes, males are affected by the HPV. In fact, there are four strains of the HPV vaccine that we're mostly concerned about. Two of them causes cervical cancers and also cancer of the penis, interestingly. And we have had patients with cancers of the penis. Just a couple months ago, I had a patient with cancer of the penis. Fortunately, we were able to excise it and he was put on chemotherapy and he's doing very well at the moment. Two of the other HPV viruses can cause genital warts, so anal genital warts. So men as well as women are likely to have both HPV viruses, if it's not for cancerous purposes, but for warts purposes. But I must say, however, that the HPV viruses that cause genital warts are seen a lot more common than the cervical cancer. And again, it's because the warts, generally people don't know it is warts that they're getting, so they keep it for a longer period of time. And by the time you get to see them, it's a number of warts that they have on their skin. Whereas with cervical cancer, because of the routine pap smears, they get to see them earlier, and so they don't present late with cancers. I think we need to let people know what's going on. In other words, the epidemiology of cancer of the penis, cancer of the cervix, genital warts. We need to educate persons about the fact that it is around, and also more importantly that there is a way to prevent this thing and to cure this. One would like to say start educating in the schools, but usually I like to say you have to take a whole of society approach. Everybody needs to get on board with this. We need to educate people, do public educations in schools, educations in churches, in community organizations. Everyone needs to be aware that HPV is around, and that at very early ages people can get infected with HPV. So I think it's an all of society approach for everyone to be knowledgeable about what can be done about it. And in that same vein, understand that the vaccine can actually prevent the onset of those warts and cervical cancers and so on. And we need to debunk the old fear that if you inoculate a child with HPV vaccine, then that gives them a freedom to engage in sexual intercourse. Whether children or teenagers take a HPV vaccine or not, they're still going to engage in sexual intercourse whether you like it or not. So you'd rather be protective and prevent them from running the risk of having a cancer, by instead of assuming that by giving them the vaccine it gives them the freedom to have sex. We really need to debunk that myth. I think, as with every vaccine program since the beginning of modern medicine, vaccines have been the single most successful medical intervention ever created by humans for protecting health. We don't hear of yellow fever again, that's because of vaccines. We don't hear much of measles, mumps, and rubella, that's because of vaccines. We don't hear much about, in fact, our incidence and prevalence of liver cancer due to hepatitis have decreased dramatically over the couple decades, and that is because we are now introducing hepatitis vaccines to persons and even to young children as well. So historically, vaccine has been the single most important and the single most successful medical intervention known. And if we're going to continue in the same vein, I also see something similar happening to HPV vaccine. That if we continue this in the next few decades, we're going to see a drastic decrease in cervical cancers, we're going to see a drastic decrease in cancer of the penis, and we're also going to see a drastic decrease in anogenital warts, and that will, of course, improve the quality of life for everyone and help us to live a better life. Well, I would like to say in summary that, public health response and public health is always going to be the most important part of health going forward. And in fact, for small island developing states like us, the science is very clear that preventative medicine is the way to go, because islands like ours are never only going to be able to have maintained the cost of treating diseases or secondary care. So preventative care is what is seen to be the best for us. And this vaccine, or HPV vaccine, is an example of what preventative care is all about. It's primary health care, preventing diseases before they happen. Because if you wait, we have now seen that treatment of disease is far more expensive than preventing disease by simply using preventive measures like education and, in this case, HPV vaccine.